Pneumonia is an acute respiratory infection. As a way of sensitizing residents in Benin City on the risk factors and preventive measures for pneumonia, some medical practitioners educated residents about pneumonia. The medical experts said hygiene, complete immunization of children, avoiding alcohol consumption, exposure to cold weather, smoking and inhalation of smoke are some measures to reduce the risk factor of pneumonia-related illnesses.
Pneumonia is usually caused by bacteria and viruses. The most important is that being a killer disease is curable and is preventable. As one of the major risk factors to pneumonia is smoking. Parents who smoke, or even parents who use firewood, charcoal or coal, and they cook inside the house where they live. Such practices enhances pneumonia.
Pneumonia that the lungs can be irritated directly or indirectly, either by what you inhale or by systemic conditions that may now spread to the lungs and cause, secondary pneumonias. However, pneumonia is not a disease that should be a threat to life if properly handled.
There are risk factors that are associated with the community-acquired pneumonia. For example, when you have the very young whose immune system is developing, there's a risk of having a pneumonia, or the very old whose immunity is growing weak. There's also a risk of developing pneumonia.
They also advised parents and caregivers to be mindful of their habits around young children that could expose them to pediatric pneumonia.
We essentially advise that children should be very much well protected because they tend to be the most vulnerable group. Pediatric pneumonias are on the increase, and they go with higher morbidity and mortality rates.
Pneumonia is a common cause of morbidity and death, especially in children and in the elderly. You find out that many people who have, the elderly population will usually succumb to pneumonias, irrespective of the primary disease condition that they have.
Children who are not immunized, then children who were not given breast milk are also at risk of pneumonia. So what do we do to prevent pneumonia? Very simple thing it is. When a child is born, we should ensure that the child is exclusively breastfed for 6 months and the mother continues giving breast milk for 2 years.
According to the World Health Organization, over 1 million deaths that occur annually can be attributed to pneumonia. The theme for this year's World Pneumonia Day is Keep the Promise, Stop Pneumonia Now. Kingsley Uchebu reporting.